Welcome back. You're listening to More Than Child's Play, where we prioritize play and marvel at every miraculous milestone. Hi, welcome back to More Than Just Child's Play. I'm Nicole Sargent, half of your podcasting hosting duo. My best friend and work partner in crime, Lacey Marisi, is not with us today. We're having a special episode of our podcast today, and I have a story to share with you. You may be wondering, if you are a longtime follower, why you haven't heard from us in a while. There's a couple reasons for that. Some exciting, some not exciting. This past year, I spent a lot of time advocating for rate changes for our early intervention program in West Virginia, which distracted and took up a great deal of my time. Lacey excitingly took a job in a public school setting as a speech language pathologist. So we're hoping in upcoming episodes she will have more to share with us about that, and has excitingly expanded our collective age range of pediatric ages that we cover collectively together. Also, this past year in March, I was diagnosed with breast cancer, and my treatment and care have taken the last several months of my time and my family's focus. And I wanted to come today to talk to you about that. If you are new to our podcast and have come to us through a breast cancer um, avenue, we are pediatric therapists, and we usually speak and talk about traditional developmental play and all things that affect young children and families and keeping them healthy and happy. And while this is certainly not in our usual umbrella of topics, women take care of children in large amounts, and breast cancer definitely affects a great number of women. October is Breast Cancer Awareness Month, and so I wanted to use our platform as we dive back into podcasting, which I'm very excited about in the months to come, to kind of give an explanation of where we've been and to use our platform to help other women. That's my hope. Um, Breast cancer is the most common cancer of women worldwide, with the exclusion of skin cancer. Based on 2024 statistics, 1 in 8 women will be diagnosed with breast cancer this year. That has certainly been my experience since I've been diagnosed. At the time of my diagnosis, I had 3 other friends in my town that were going through the process the same time I was. And since then, I have been met many other people, sorority sisters of friends, people's sister-in-laws, cousins, who have been navigating the same process, and friends have asked me to talk to them about my experience and what I learned. So it's kind of another reason why I wanted to put it out there, so that if you are coming to this diagnosis or have a friend or a family member who is, I'd like to share what I learned to help with that. We do know that there are some risks that make breast cancer more likely. The risk of breast cancer goes up with age, although we're seeing it in younger and younger women. Having a family history is a risk factor, and other risk factors, some of which I knew and some of which I didn't know, include early menstruation, starting your period at an early age, late menopause, breast density, obesity, and alcohol consumption. I want to start this episode by saying what I'm sharing today is simply my story. Everyone's story is very different. Everyone's choices are very unique and very personal. I'm not sharing any information here as a physical therapist, but as a patient myself. And all I can share is my story and the choices that were before me and the decisions that I made, in hopes that it helps other people. But in no way does it disregard someone's choices who might be different than mine as not the correct choice, because everyone's choices for them and their care is the right choice for them. So all I want to talk to you today about is my story. Um, so breast cancer has always been something that's been on my radar. My great grandmother died of breast cancer I believe in her early 70s. My grandmother, my beloved Tata, was diagnosed with breast cancer in her early to mid 60s. She lived to 94 years old and did not die of cancer. My aunt, same side of the family, my beloved Aunt Layla, did pass from ovarian cancer. So female cancers have always been on my radar. My family had had genetic testing through the years. Obviously, genetic testing has evolved, and the versions that they had, no one had tested positive for genetic mutations that increased risks of breast cancer. But it was always on my radar as something that might happen to me. When I was in my 30s, I found a lump in my right breast and had it removed, and it was thankfully benign. Um, I saw a breast specialist for a few years after that for just extra checks. To be honest, I knew I was supposed to be doing self exams, and I found them very difficult to do because everything felt very lumpy to me, and it was very hard for me to tell changes month to month. I started getting recommended mammograms at 40. At that time, I would always get the letter in the mail that said, everything looked fine to us, but you should know that your breast tissue is dense, which makes it harder to read a mammogram. I personally found that very frustrating. It's like everything's fine as far as we can tell, but we can't really tell. It was very stressful for me. There were many periods. I'm 48 now, so I've been receiving mammograms for 8 years. There were many periods during that time where I was called back for an ultrasound. There were places that they would watch every couple months. At the end, they would always say, everything looks fine, don't worry about it. I started talking to my family members, and I have family that live throughout the world. And some members of my family were receiving breast MRIs, and I started to ask why, particularly my family in Canada. And MRIs are more sensitive, and they can detect false positives. Um, False positives. Did I say that right? Yes, false positives. Things that aren't really positive but look positive because they're so sensitive. When I asked my doctor about MRI at first, I was told just that. They're too sensitive. They cause us to see things that aren't really tumors. They cause unnecessary biopsies. You don't really need those. And I accepted that at first. Through the years, the further I got through my 40s, I ended up having to need more ultrasounds, more return mammograms. I started to see calcifications in my mammograms, which can be benign but can be concerning. And my anxiety started to rise, if I'm being honest. It was a very anxious situation for me to have all the testing and retesting. So I finally got kind of bold with my doctor and I said, I want an MRI in addition to my mammogram. And if you won't write a prescription for it, I will go somewhere else. And if it's because of insurance, I will find a way to pay cash for it. I had had an ACL tear and I had learned that sometimes paying cash for a discount for an MRI is actually cheaper than the copay. And I had learned the ways around that and I was willing to save money because it was worth it to me. And so finally my doctor said, sure, you can have an MRI. And so I started this process of at the end of the summer, I would get a 3D mammogram, and at the end of the winter, I would get an MRI. And I did that for 3 years. A couple times during that time, they would have me come back for a second look, but for the most part, everything was fine. I had that process last summer. Mammogram was fine. Then I went for my MRI in early March. Um, and to be honest with you, I had a very weird feeling. Again, I get a lot of anxiety with these tests, but something was just kind of different for me. That day, I had my MRI early in the morning and I had a busy day. I met a childhood friend and we actually drove 4 hours to the town I grew up in to support another friend of ours who had tragically lost her brother. We arrived at our other friend's home to change our clothes before attending the funeral home. And when I went upstairs in my friend's house to change my clothes, I got a notification in my MyChart that my MRI results were in. And I read them. and it reported that I had a small tumor, a small mass, and that it was spiculated. And that was the first time I had heard that word, spiculated. So, AI and Google can be our best helper and our worst enemy. Quickly saw that that was probably not good. Sent out the 911 to all the medical people in my world through text. Continued to get ready, went to the funeral home, um, visited and supported the friend. On the drive back, my friend Shannon, God bless her, drove even in some bad weather while I basically managed the next phase of my life through texting on phone with my helpers in my world. And because of those helpers, I received a call from the head of oncology the very next day at West Virginia University, Dr. Hannah Hazard, who is my oncologist, and she's incredible. And she is the perfect combination of direct, but empathetic. And she didn't beat around the bush. She said, I feel very confident that this is probably cancer. I also feel very confident that it is early and that I expect it to be very treatable, but we won't know anything until a biopsy is done. We will help you figure this out. So, several days later, I went to Morgantown, to the University Hospital Center, and I had further testing. They could not find my tumor on ultrasound. The radiologist himself spent about 45 minutes trying to find it and could not find it. Um, they did their own mammogram and looked at it in combination with my MRI from the year before and from this year, and were finally able to locate it that way. They noticed that the radiologist in Morgantown told me that it was there last year on my MRI and that it had not changed shape, or it had not changed size, I'm sorry, but it had changed shape. And that was news to me because my previous year's MRI had never mentioned this spot. It wasn't a spot they were watching. So, what I learned from that is board certified breast radiologists at breast centers have extra training in looking at breast tissue, and they only look at breast tissue. Radiologists at other places are responsible for reading films on every body part. Doesn't mean that they're not good. It just means that the breast certified radiologists have a more attuned eye to find breast tissue, particularly in complicated situations like with having dense breasts. So that was lesson number one for me. They scheduled a few days later a biopsy. That biopsy was done while I was in a mammogram machine. I also didn't know they did that, but they couldn't do it with ultrasound because they couldn't find it on ultrasound. It was very deep. I was numbed locally. I won't say it didn't hurt, but it was manageable. And then I was told that I would wait on the results. We had a previously planned trip with our college age daughters for spring break to Aruba. I questioned whether I should go. Dr. Hazard told me that I should go. I should try my best to relax and enjoy it because I would probably have a busy few months after that, and that I should enjoy my time with my family. So we went. I will say this was the absolute worst part of the whole entire process for me, despite the fact that Aruba is beautiful and I highly recommend it for a travel destination. When you don't have information, in my experience, my mind likes to fill in the blanks. And as the days went on and I didn't hear, the blanks continued to get filled in for me. And I had spiraled into all sorts of scenarios, in full vulnerability, that I had a rare form of cancer. At the time, there were a lot of cuts going on to NIH and clinical trials, and I was very scared that I was not going to be able to access the care I needed. I spiraled wondering if this would be my last trip to the ocean, if I'm being honest. It's my favorite place in the world. So, as much as it really forced me to be present and enjoy every little detail of my beautiful family, the waiting was painful and excruciating. I will say that when I was first met with the doctors, they did draw blood and do genetic testing. And I did find out quicker than I got my biopsy results that my genetics were negative. So they tested for 40 genes, not just for breast cancer, but for other cancers. The PA I worked with was incredible and said that it's basically like taking books off a shelf and they're looking at each one to see if pages are deleted, if they're turned upside down, if things are missing, and then they put it back and go on to the next one. So I was relieved to hear that I did not have a known genetic predisposition to breast cancer, but they were able to tell me with my family history that there was clearly something familial here. There was something about my family, whether it be environment of where we lived or something about our medical makeup that made breast cancers more common.
Hi, friends, Nicole here. Just a quick pause in the conversation to let you know about a couple of exciting things we have to offer you. When Lacey and I started having children many moons ago, and our friends were doing the same, they started asking us when they could expect their children to do certain things and how they could encourage their development. It was then that we realized there were resources that listed milestones and some that shared play ideas, but none that paired those together purposefully the way we did for families working in early intervention. So we decided to create that resource. For over a decade now, 123 Just Play With Me has been used by parents, therapists, physicians, and nonprofits to encourage traditional developmental play as the best way for young children to learn. Organized in a digestible card style format and color coded for the 5 domains of development, it is perfect for anyone caring or working for children ages 0 to 3. Our award-winning product is available with free shipping every day at milestonesandmiracles.com or on Amazon. It makes a meaningful baby gift for new parents and a practical tool for early childhood therapists and professionals. In addition, if you are therapists, check out the professional tab on our website, milestonesandmiracles.com, to access discounts on individual courses we offer through MedBridge Education, or for $101 off an annual subscription to unlimited continuing education courses. I personally use MedBridge for my own CEU needs and use their home exercise builder with amazing pediatric content, exercises, and educational sheets daily as an effective option for consistent follow-through with parents at home. We hope you'll check it out. Now let's get back to the conversation.
When I finally received my biopsy, I was more than ready for it, obviously emotionally, but I had done my research, talked to a dear friend of mine who had breast cancer, to be ready to receive the information I was getting. Because when you get a biopsy result, there's a lot of information. So the first thing you get is the staging, which talks about the size of the tumor. So under 2 centimeters, I believe, puts you at stage 1. And my tumor was slightly below that. So it was a stage 1 invasive ductal carcinoma, meaning that it was a cancer that started in the milk duct but had invaded the breast tissue outside of the milk duct. Next, they give you a grade, and in layman's term, it's sort of how mutated the cells are or how messed up the cells are. I was very fortunate that my grade was also 1. So small tumor, cells messed up, but not as messed up as they could be. The next thing that's really important that they look at is the receptor status. So on the surface of a cancer cell, there are some things that they look at. The first thing they look at is if the tumor is estrogen and progesterone positive or negative. And what that means is there's a marker on the cell that will tell them if you have a positive tumor, an estrogen and progesterone positive tumor, it means that estrogen and progesterone grow your tumor. Your tumor grows based on the presence of those hormones. If you are negative, it means that those hormones do not affect the growth as significantly. Now, again, I'm not an oncologist. This is a physical therapist and patient explaining that. So my tumor was ER/PR positive, or estrogen and progesterone positive. I was told that this was good news because it is easier to treat some of those cancers because there are ways to decrease the hormones, which then decrease the growth of the tumor or the chance of tumor growth in the future. The second thing that they look at in terms of receptor is HER status. So I'm sure you've seen commercials or heard HER2 positive or HER2 negative. That is for the presence of Herceptin, which is another marker. And I was HER2 negative. Again, I don't know detailed oncology, but I do know that HER2 positive tumors are a little more aggressive, although there are thankfully ways to treat them. And then finally, they look at the cell turnover rate or something called the Ki-67. So mine was 2%. And what that meant was that the cells were growing or changing at a 2% rate out of 0 to 100%. So basically, I learned I had a small tumor, that the cells weren't very mutated. It grew because of estrogen and progesterone. It did not have HER2 positive presence, and it was growing slowly. Dr. Hazard told me initially that she was guessing, based on the looks of it, that this tumor was slow growing and that it had probably been there for several years. That kind of freaked me out, but she said some of these early breast cancers are there several years before we can detect them on imaging, which I thought was interesting to know. So now that I had my stats and weirdly was thankful for them. That sounds strange, I guess, to be thankful that you have cancer, but I was told by the PA, this is the best of your bad situation. This is what we hope for. So I was thankful for that. We set up meetings, a whole day of meetings with oncology, medical oncology, and plastic surgery. My husband came with me, and my dear friend, who was my professor, Corey. I recommend taking a sound medical person with you who can listen to the details without becoming overly emotional, because my husband Brent and I were definitely emotional. In that time between when I received the markers and that day of those appointments, I spent a lot of time trying to research what would my questions be. I wanted to make sure that I was making the best decisions, that I wasn't leaving any page unturned. I feel prepared in times of anxiousness by researching, reading, coming up with a plan, making sure I know all the things as much as I could know. To be honest with you, it was a little hard to find information. If you listen to We Can Do Hard Things, Glennon Doyle's sister Amanda had breast cancer, and she has several great episodes that I actually listened to 2 or 3 times and took some notes. I found that to be very helpful. I also found an invasive ductal carcinoma group on Facebook. Again, this could be a blessing or a curse. It's a great place to have questions answered and to receive emotional support, but it can be overwhelming. So, if you are listening to this with a cancer diagnosis or know someone who is, just tread lightly there and know yourself and what is healthy versus harmful to you. So, I made my questions, and in true type A firstborn status, I have typed them up and saved them and shared them with people. So I will try to attach those to the notes with this episode in case that's helpful to anyone else. So, first, we met with oncology with Dr. Hazard. They explained the kind of cancer I had, they explained the receptor status, and they said to me, this is a very treatable breast cancer. At 5 years, the survival rate is almost 99%. And I said, that's wonderful, but I'm 48 and I plan to live a very long time. What is the survival status at 20 years? And what she said to me kind of took my breath away. She said to me that um, they have studied breast cancer for years, and they typically used to see this disease in women in their 60s. And um, what they are finding now is that they are seeing women earlier and earlier with it. And so, women in their late 60s, early 70s who had breast cancer were living beyond the 5-10 year mark. And then they were dying, but typically not of breast cancer, most of them. They were dying of old age or other things. The problem is that now they're seeing this in younger and younger women, and they do not yet have longitudinal studies to look at longevity and survival rates 10 years, 20 years, 30 years out because it was a disease that they didn't see in younger women previously. That made me super sad, a little bit overwhelmed, and also rang true to me because in these groups I was seeing online, there were a lot of women even younger than me, women in their 20s with women in their early 30s, women with toddlers. And I was having a broken heart for these women, thinking, this is so hard for me. I have two children that are in college that are, fairly independent adults. And I can't imagine what this would be like with babies. And so I asked Dr. Hazard, why do you think that we are seeing this in younger women? And she said they were studying it, and the leading theory right now is plastics, microplastics in everything, air, water, food, lots of different things. So we can talk more about that later, but it's something, another reason why we really need to keep the pedal to the metal on funding for research and considerations for environment because they are seeing it in younger people. Um, we talked about options for me in terms of treatment, and she was very clear that I was a very viable candidate for a lumpectomy, that I could have a lumpectomy. I would probably be off work for 2 weeks. I would require some radiation, probably for a month or so, and then I would be good to go. The other option is I could have a single mastectomy or I could have a double mastectomy. And then after that surgery, there's lots of options. I could choose to reconstruct breasts or I could stay flat. I was pretty adamant from the get-go. I will say I went in with some pretty preconceived notions based on my family history. My grandmother had a single mastectomy, and while she lived a very long time, the asymmetry caused her a lot of orthopedic problems with her shoulder and her spine. So that was not an option for me. Radiation is almost always done after a lumpectomy, and they explained it to me. It's like if your tumor is a piece of glitter, they can take the largest clump of glitter out, but we don't know about cells around it, so they radiate the breast tissue to kill any that was left behind. Um, there are pros and cons, obviously, with that approach. There's a shorter recovery time after a lumpectomy and radiation. The surgery is less invasive. It's not as long. There are fewer complications in terms of infection, rejection, um, all of those things. There are, risks with radiation. People can receive burns to their skin. The tissue can change. It can be harder to reconstruct tissue down the road that has been radiated. So one of the factors for my decision was if I chose a lumpectomy and radiation and later on down the road I needed or wanted a mastectomy, reconstruction might not be an option. Um, it's a hard decision. And I'll talk a little bit more about that decision in a minute, but that was one thing that we talked about and I was very honest with her and told her that my family history, I was very involved with the care for my family members who had had cancer. I watched the trauma of my young cousins losing their mom, sorry, at an early age. And that has been a wound that my family is still recovering from. And I just didn't want that for my girls, or for my husband. And I wanted what I saw and felt as my best chance to beat this and keep it away. Um, there is a slightly reduced risk of a reoccurrence with a mastectomy versus a lumpectomy. The numbers aren't big, it's single digits. But for me, those single digits mattered. Any percentage point I could decrease that mattered to me. And I told her that. She rightfully so just pushed back and wanted me to understand that, a double mastectomy is a 4-hour surgery. There can be complications with the surgery, with infection, with, you know, long-term recovery, all of those things. And she gave me a lot to think about. And when I left that appointment with her, wasn't completely sure. I then met with medical oncology. Medical oncology is the doctor who tells you how they're medically going to treat your cancer and keep it away. So there's a brand of medication called immunotherapy is one way that they treat cancer, and they treat it based on that receptor status. So the first thing they needed to know was if I was in menopause, which is a funny kind of question because I had a uterine ablation years ago for endometriosis. And so I really didn't know if I was in menopause. I figured I was in perimenopause, but I had not had raging hot flashes or some other symptoms that my friends had had and suffered from. So I was unsure. So they drew my blood to figure that out because if you are premenopausal, the immunotherapy is one kind of medication, and if you're postmenopausal, it's another kind of medication. We quickly found out that day, surprise, I was in menopause. I had no idea. So that meant that I qualified for a medication called Arimidex. And Arimidex's job is to turn off estrogen and progesterone. So that, as far as I understand it, so that I think of estrogen and progesterone as the miracle grow that makes tumors grow in my body. And the lower chance we have of having those, the lower the chance of my cancer coming back. I started taking that medication immediately because I had to wait 6 weeks for surgery. And they told me that interestingly, during COVID, they started patients on immunotherapy when they were waiting for operating rooms, and they found that their tumors either stayed the same or shrunk. So I was comforted by the fact that my tumor would hopefully be held at bay while I had to wait. I'm a very impatient person on the surgery. I will take that medication for 5 to 10 years, depending on side effects. There are risks, of course. It can raise cholesterol, it can decrease bone density. I had to have a bone density scan, and that will be monitored to check my bone health. I also learned that after 5 years, they will retest my tumor. It stays in a jar, and we will continue to look for better medication when I can no longer take or tolerate the Arimidex. Arimidex and other immunotherapy medications can be debilitating for patients. Um, there are lots of different options now, thankfully, and doctors can change people around and try different ones. Some might be better than others. I can say I'm very thankful that I have not had a problem with it, and I can talk more about that in a minute. But basically, I decided then wild horses would have to drive me away from this medication because, again, my goal was getting it out and keeping it away. So after 3 to 4 hours of meeting with medical oncology, crying, stressing, worrying, hearing things about reoccurrence rates and survival rates. It was very heavy stuff. We then went to meet with plastic surgery. I had never been to a plastic surgeon before in my life. I had no idea what to expect. I learned that I had options, and that sort of gave me some power. So, um, option one, of course, was a lumpectomy. He explained to me that based on my breast size and my age and my tissue, that if I had a lumpectomy on the side of the cancer, they would likely have to do a reduction and a lift on the non-affected side anyways to have any kind of symmetry that would look normal in clothing. When they do a lumpectomy, they kind of rotor-rooter around it. Interestingly, they put that tissue in a mammogram machine to check for clear margins, and they go back and keep doing that until they get clear margins. So, depending on the margins, the portion of breast tissue they take out can be substantial enough to affect symmetry. That personally helped me clear up my decision. If I needed to have surgery on both breasts to have symmetry, I wanted to have a double mastectomy. And my husband and my support system agreed. So your options, again, which are highly personal, are you can have a lumpectomy, which for a lot of people also means radiation. You can have what they call going flat or an aesthetic flat closure, meaning they remove as much breast tissue as they can and just cleanly close your chest to be flat. Many women do that, and I understand why. You can have several options for reconstruction. They can do something called a flap, where they take tissue from your back and your belly and reconstruct breast with your own tissue. It is a longer surgery. I was told 9 hours, and it would require about a 3 to 4 day ICU stay. But the benefit of that is you don't have to have reoccurring surgeries to swap implants, and it feels more natural, can look more natural, and if you lose and gain weight, it changes appropriately because it's your own tissue. I was already a little nervous about a lengthy surgery, so I took that option off the table. I also took the flat option off the table just because at my age, I felt I wanted some sort of reconstruction. Again, a highly personal choice. So if you want to have reconstruction and you're not going to do a flap, you can do implants, and the options are that sometimes they can remove your breast tissue and then put the implant in one surgery. They call that direct to implant. Other times they can't do that, and they have to put what's called an expander in, and you have to have that in for several months and then have another surgery later on to swap the expander and put the implant in. I understand that smaller breasted women often have an easier time going direct to implant, and also women who have thicker skin. Without being, I guess, too revealing. I'm a 48-year-old woman. I breastfed two children for 13, 14 months each, partially because I wanted the benefits for them. And to be honest, I wanted the benefits for me for reducing breast cancer. A lot of decisions I had made in my life were based around this. And yet, ironically, as Dr. Hazard said to me, here we are. My skin was too thin for to do a direct to implant, so that was off the table. So I decided to do a double mastectomy. We made that decision, we knowing that it would likely be expanders. An expander is placed either on top of or under the pec muscle, and it's sort of like a plastic hard disc. And you go into the doctor's office, and over time they use a kind of a stud finder to find a magnet, and they use a needle to inject saline gradually into the expander. And that's what it does. It expands and it stretches your chest cavity and your pec muscle to kind of excavate and make space for an eventual implant. And that's what I eventually had done. Um, Again, there's lots of things that go into this decision. If you're going to need radiation, if you're going to need chemotherapy, sometimes you need that before you need the surgery. Sometimes you get that after the surgery. They had decided for me that they wouldn't know that answer until after my surgery. So I knew if I was going to receive chemotherapy or radiation, it would be after surgery. Emotionally, for me, plastic surgery was kind of a breath of fresh air. He was the doctor who his name is Dr. Sebastian Brook. I'm going to thank all my doctors at the end, but he and my husband agreed was the guy who was like, this is how we're going to put you back together again. This is going to be hard, and there's going to be loss and there's going to be grief, but this is how it's going to be better. And after that long day, it gave us hope, and it made us feel like, there might be some new normal for us. So made those decisions, came home and waited on a surgery date. In the meantime, I threw myself into getting ready for this surgery. I made lists. I made lists of what I was going to need. I made lists and purchased things I might want to buy. I set up areas in my house where I would be comfortable after surgery. I met with a physical therapist to understand what to expect for pain and rehab. I mean, I was just basically a breast cancer student. I have those lists and resources and will be happy to share those as well. Um, so that, the time passed. I will also say one other thing I did while I was waiting was I had sat long and hard with myself to decide about what kind of patient I wanted to be. I've been a therapist for 25 years. I've seen all kinds of patients, and I knew very quickly what kind of patient I wanted to be. I wanted to be a proactive patient. I wanted to be a follow the rules patient. I wanted to do whatever I could do to give myself the best chance of a clean and safe recovery and a very long life. And so I committed then, like, I'm in. This is it. This is my new normal. And while I grieved the carefreeness of the time when I was not a cancer patient, I prepared for the time when I was. So part of being that patient was understanding I was going to need help and asking for help. And so I started thinking about what I actually wanted for help. And I was specific with it. And I had a lot of help. Friends brought us meals for over a month, and they followed my requests and honored them for healthy foods. I set up a walking schedule. My friend, Lacey, our co-podcaster, my best friend, set up a meal schedule with my other friend Paige and a walking schedule, and people signed up to walk me for the company and the support. Other things, I actually wrote down things that people did. So if you are someone going through this, you could consider, or if you're helping someone with breast cancer, this is what I received and what I found helpful. In addition to the meals and the walking, people would drop off or pick up groceries. I had a friend drop off produce baskets from a local farmer's market. We received DoorDash and restaurant gift cards. I had soup delivery from Spoonful of Comfort, and even my friend Megan drove from Pittsburgh 4 hours to my house with her grandmother's beef stew frozen in containers for me. People hung funny signs in our home. My friend Paige and her daughter Meredith made a sign still up in our kitchen that said, "Sorry, your titty is being shitty." It did have a Bible verse on the back, but just things like that were just silly and supportive. Friends gave coffee gift cards for my family the day of surgery. My dear friend Corey offered her home, which was close to the hospital because it's about 2.5 hours from my house, and we camped out there for doctor's visits and hospital stays. My mom did our laundry. I have a tribe of women that checked on my girls because they knew that was my highest priority and did things for them that I couldn't do then. Helped move out of the dorms and into an apartment, made a birthday cake, painted retired furniture for college apartments. Just they helped me to mom when I was down. Um, our pastor called and prayed with us literally while we were driving to surgery. I got all kinds of thoughtful and generous treats, blankets and socks and board games and puzzles and coloring books and snacks, some beautiful button front pajamas, which were very helpful and cozy, creams and all kinds of things. Our church, in a huge part, sent cards. I think I received a card in the mail every single day for over 2 months. And I love paper and I love mail. And I can't even tell you. I know a card doesn't seem like a big thing when you're sending it, but it seems like a big thing when you're receiving it. And it really did lighten my spirits to hear words from people that loved and prayed for our family. Um, it was overwhelming. I have a huge basket of them. And when I'm looking back at this list of things that people did for us, we never felt alone. It can be very isolating, and I've read stories of people who don't have anyone, and that was not our case. And I feel just very, very fortunate. for the support, not just that I had, but that my girls had and that Brent had, my husband. We had so many people praying and checking and doing for us. And I should also mention that one of the things that personally is most meaningful to me is when people would tell me that they called their elected representatives and requested ongoing funding for cancer research. That's that I'm a big advocate legislatively for a lot of healthcare issues, and that really meant a lot to me that other people would do that. So, anyways, oh, sorry. We made it to surgery. Um, I did have some, moments of this is it. Thank you, girls. You've been with me for 48 years. You have um done me well in many ways in my life and had a minute to kind of say goodbye to that stage. Um at the hospital, they injected me with radioactive material that would help them to identify the sentinel node or the queen bee of my lymph nodes. They said that you can think of lymph nodes in your armpits like a strand of pearls, and they take the first one in the strand and test it while you're still under anesthesia. If it's negative, they usually go to the second or the third and they stop there if they're negative. But when they have positive nodes, they keep going until they have negative nodes. So that radioactive marker that they inject you before surgery helps with that. They gave me a little loopy medicine before I went back. Um, and that was the hardest part because when you're out and you don't know what's happening. I remember very little of being in the hospital. I was given medication to help with nausea, and I think it really made me loopy. I don't even really remember leaving the hospital the next day. I spent one night there. Um, I had very little pain when I woke up. I did have a nerve block, which helped with that. When the nerve block wore off once we were home, I mean, there's no way to beat around the bush. It's not a pain-free experience. Obviously, there are large incisions. You come out with two drains that are really the worst part, I think, by your ribs on either side. Those drains require frequent emptying and monitoring how much output because it's dealing with drainage inside your chest cavity, and you communicate that with your doctor. You're in a surgical bra, which provides a lot of compression. I needed a lot of help with mobility, getting in and out of bed, taking care of the drains, staying on top of the um, medicine schedule. There certainly was pain for sure, but it was manageable with a combination of pain medication, nerve medication, muscle relaxers. I did use a wedge system that was invented by someone who had breast cancer to sleep, and I will say it really did help me. I'm a belly sleeper, and I was able to get quality sleep using the wedge system. Um, about 8 days after surgery, my drains were removed in the office. They just tell you to exhale and out they come. It did not hurt as bad as I thought it would hurt, and I immediately felt better. Um, I was able to move more easily. I was less tender. Still had discomfort and spasm, but it definitely was better. I immediately started seeing a board certified physical therapist. I am going to toot the horn for physical therapy. Of course, I am a physical therapist, but Dr. Megan Burkhart at WVU saved my sanity and my mobility. I would think I was fine, and she would be able with her hands to find areas within my chest wall, my neck, my shoulders that were in spasm. She helped in my opinion, decrease my chance of lymphedema. You can have lymph swelling after lymph node removal. My arms, I was able to avoid any swelling in my arms. I saw her regularly. Every time I went for a fill in my expanders, I saw her and I physically did so well. And it is absolutely because of her. I learned that most cancer patients have an average of two physical impairments, and very small amount of those patients get referred to physical therapy. That includes patients who have head and neck cancers and have jaw reconstruction. And I thought to myself, I had my ACL repaired and I went to physical therapy for 18 months. And what small percentage of breast cancer patients who have incisions all the way across their chest are even seeing a physical therapist? This is crazy. It's a very large portion of your body. Scar and complication is common. If you're going through this, please find a physical therapist experienced with breast cancer. And if it's a friend that you're listening for, please tell them to do that, because she really got me moving and going and decreased my pain considerably. While I was going through the process of recovery and then eventually starting the expander fills, I received something called an oncotype, which took about 3 weeks after surgery to get back. This is a number that, based on science and the exact DNA of my tumor, was able to tell me if I did nothing but surgery, what were my chances of reoccurrence? If I did the immunotherapy with the Arimidex medication, what were my chance of reoccurrence? And if I had chemotherapy, how would that change those numbers? My onco score was 11, which is what we were hoping. We were hoping for under 15 or 16. And what it said to me was my chance of it coming back with distally in another part of my body, with the immunotherapy was less than 3%, and adding chemo to the mix changed that by less than 1 percentile. So the risks and harms of chemo didn't give me any benefit. It was more harmful than hurtful. That is when I knew I would not have to receive chemotherapy or radiation. I also learned that my lymph nodes were clear. Again, it is not a answer or a result that I take lightly. I was extremely thankful, not just for the result, but for the reassurance that this wasn't just a guess, that this was based and rooted in science and research. Um, and so I appreciated that. So I went through the expander process. The benefit of that is you can kind of try on a size. You can keep filling until you say this is the right size for me. I actually preferred a smaller size than I was before surgery. I started regaining exercise regularly. I was feeling great. My plastic surgeon told me in the beginning, there's only two silver linings with having breast cancer, and one is you will not need a bra, and the second is your insurance will pay for breast reconstruction when you need it because it has to, because you're a cancer patient. And I did very much enjoy and have enjoyed not having to wear a bra. One thing I didn't touch on in terms of surgical options is some women do choose to do nipple sparing procedures where they try to save your own nipple. Other people choose not to. I chose not to because, again, I was trying to get as little breast tissue as possible, and the nipple is breast tissue. So that was just my own personal decision. I understand completely why that leave some normalcy for people. And so I understand that decision as well. A lot of people who do not have nipple sparing consider 3D tattoos after the surgical reconstruction is all done. And so that may be an option for me. But again, it contributes in a practical sense to not having to wear a bra. And a lot of women say that is part of the reason why they like that. One other thing that I should touch on in the recovery process is you do lose sensation with a mastectomy, usually. And that is a very difficult part of the decision as well and very personal. I can still feel when I put my hand on my chest or if my kids or my husband hug me, and I am thankful for that. It has changed over time. I feel like I've regained some sensation that wasn't there originally. It was almost like numb, like hyper numb. And I don't know how that will change over time, but that's a realistic part of the consideration as well. Um, I really started exercising a lot for mental health, and I learned that there are studies that show that 150 minutes of moderate exercise and 75 minutes of vigorous exercise a week have shown in studies to be as beneficial as chemotherapy in some cases for hormone sensitive cancers. I've always been a big exerciser, but it is no longer an option, or I should do it. In my mind, it is prescriptive, just like my medication. And so I don't have a fancy gym membership. And I do use an app that I pay $20 a month for, and I lift weights and walk, bike, or swim almost every day of the week. And in the recovery process, that was super, super helpful for me. One other change I did shortly after surgery was I did start researching the products I was using. We know that parabens and phthalates in um, cosmetic products particularly can be estrogen mimickers and can be potentially more dangerous for patients with estrogen sensitive cancers. I was told that the research on that is not definitive but is growing. So I decided I was just going to make those changes because those things probably weren't great for me either. I used the Yuka app and made some phone calls to cosmetic companies and did some research and kind of redid my whole regimen. If that, it was overwhelming. So if a list of what I'm using is helpful to you, I'm happy to share as well. Um, I had an exchange surgery a week ago. Yes, tomorrow. So last week, they took my expanders out. They put implants in. I chose to have my implants go under the muscle because that increased my chances of being able to feel a reoccurrence as my body would present as skin pec muscle implant, nothing between. They can't take all the breast tissue out. So, there is a chance of reoccurrence in the chest wall. When I asked about how that is monitored, they said most people will see or feel something. And obviously, it is smart to do examinations still to look for that. And I wanted my easiest chance of finding that. That surgery was substantially easier than the first 2 hours versus four, no drains, no overnight stay. I took a muscle relaxer, I feel like the first day, and a Tylenol the second day, and I haven't had medication since. My mobility was much easier. For me, that was definitely much easier to recover from. Um, there's so much that can be said on this topic, but one other thing I definitely want to mention is through my own research, I was uncomfortable with the plan after all this hypervigilant monitoring my whole life with breast specialists and MRIs and mammograms. How are we going to tell whether it comes back? And the answer was, well, you do your exams, and if you have any symptoms, you let us know if you have any pain anywhere. And I didn't really like that. Waiting until I have bone pain didn't sit well with me. So I did learn about a blood test called Signatera. It's one of several blood tests I understand that can actually miraculously detect the blueprint of your MRI in your blood. So if there are a few cancer cells somewhere else, it can pick it up. So I asked my medical oncologist about it, and she drew my blood for it, and I'm waiting on the results of that. I will have that done every 6 months for the first year and then yearly after that, as part of my monitoring process. And that did make me feel reassured that if it does come back, because sometimes it does somewhere else, we would hopefully be able to find it earlier versus later. Um, a few more things that I think are important to remember. My my cancer is estrogen and progesterone positive. So if I'm in menopause and I'm taking this medication to turn off any residual estrogen, why would it come back? Well, or if you're in menopause, why do you need the medication? I guess would be the better question. Other parts of your body, your adrenal glands and fat cells release estrogen. Of course they do, right? So It's not just your ovaries that release estrogen. So that's why the immunotherapy helps to manage that release of hormones. I had lots of questions about my daughters. I was told that they should have a mammogram 5 years, 10 years, I think they said, prior to my, yes, 10 years prior to my age of diagnosis. So I'm 48. They should have mammograms at 38, which typically they would have started at 40. That will be a question we continue to ask. If genetic testing evolves, that will be something I will continue to look at with the hopes of protecting them as much as possible. I think it's really, really important. Um, I think those are the main parts of my story. If you've listened this long, I appreciate you listening. Even if one or two people hear this story and it's helpful to them or encourages them to ask for more detailed imaging with an MRI or an ultrasound if you have dense breast tissue, or to do your monthly exams, or to not skip that mammogram. Moms and women and daughters, we're busy caretakers of other people, and often we don't take care of ourselves. And I just want to say that we can't take care of anybody else unless we take care of ourselves. And it's not selfish. It is important to put your health first and to be vigilant in this area. 1 in 8 women is a lot of women. I can't even tell you the amount of women I've met or talked to in the past few months that have gone through a similar journey as I have. And so until we continue to increase funding and research to figure out why and to stop this from happening in the numbers that it happens in, we need to be vigilant to make sure that we're finding these tumors early. I feel very fortunate that if this was going to happen to me, that it happened the way it did so that I could receive care early with, you know, as minimal as possible disruption to my life. Yes, surgery is a big risk. Yes, a mastectomy is a huge loss. I am not negating that at all. My life is forever going to be different. I will forever be a cancer patient. This will always be part of my story and part of my surveillance. But I do feel lucky that I was given the right tools and definitely the right people. I can't say enough about WVU, West Virginia University, my alma mater, and the Mary Bab Randolph Cancer Center. My husband and I describe it as the Disney World of medicine. We've dealt with a lot of medical practitioners personally and professionally, and they are top notch in terms of making sure patients are empowered, cared for. I have not waited for an appointment or a callback. They have a patient navigator who makes sure all of my questions are answered. People call to check on you. My doctors, Dr. Hazard, Dr. Zhang, and Dr. Brook, are the best of the best. All of the PAs, nurses in their offices um, were so personal and wonderful to me. I don't want to get emotional again, but I am endlessly thankful for their care. So if you are regionally in that area, I cannot recommend them enough. Anyways, we hope to be back in your ears soon with some regularly scheduled pediatric topics. But I hope that this topic that affects so many women can help someone today. And I thank you for listening to my story. So thanks for being with us, and we look forward to seeing you next time.
Hey everybody, we just want to say thanks for taking the time to join us today. It's true for all podcasts, but especially for ones like ours that are hosted by small business women, that your support really does mean so much. If you've enjoyed what you've heard today, we hope that you'll go to Apple Podcasts or Spotify or wherever you listen to podcasts and hit the follow button. We want to ensure that you have a seat at our table for every important conversation we host, and following the podcast ensures your invite. As therapists and mothers, we've lived and learned that community is really what we all need and what helps us to be our best. If this episode reminded you of someone who could benefit from being part of our community, we'd be honored if you'd share it with them. At Milestones and Miracles, we believe that play builds brains, and it's a wonderful way for us all to stay healthy and happy. So no matter what your age, take some time to play today, and we look forward to seeing you next time.